Like, everyone at the ARC works tirelessly to help people every single day, and today's an example of everyone coming together to learn about new services, get information, network with others. And the reason for that is we all have the same goal, right? We all want to help people with intellectual developmental disabilities live their best life, whether we work in the field or we're a family member or we're both. And I think the ARC just really exemplifies that in everything that they do every day. And today's an example of that. But I did just want to tell a little story and give some kudos to Gary and Dave. Several months ago when I was the SSA director in Mahoning County, we were having a lot of problems with homelessness. And Mahoning County is in Youngstown, for those of you that know where that is. That is where I was born and raised. And we had a family who, the dad had passed away very unexpectedly. Mom was left with 3 children, 2 of which had autism, and she was really struggling. She was not able to pay her bills, and she was very depressed, and the family was really struggling, and they got evicted. And so the SSA, of course, was working with everyone that she could to try to help find housing for this family in the bitter, bitter cold of a polar vortex in Ohio. And I reached out to Gary and Dave and told them the story, and they didn't even ask a question other than, how can we help? And I think that's what the ARC is all about, right? How can we help? And they did. They did immediately help. They became a part of the team immediately. The family was emotional, and so was the SSA. And we were able to get them some temporary and safe housing, food, clothing, help them get reorganized with their life so then mom could just take a breath, right? Moms and dads, do we need a breath? Yeah, I do, for sure. And then from there, the SSA was able to work with our community and able to get them into housing. And I was telling Gary and Dave before today, they are flourishing and living their best lives in the community now. And that's because of the help of the ARC, right? I think we often forget that it's not just about today coming together and having speakers and learning things. It's also the help that they offer every single day. And I just want to thank them for that. So I want to talk a little bit about Station MD. As I said, I came from Mahoning County. I was the SSA director there for many years, and learned about Station MD and just fell in love with their service. I have a child with a medical disability, and it is a struggle for my family to get him adequate medical care, which I'm sure many families here in the room experience every day. And so when I learned about Station MD and I met all the clinicians that work there and saw how passionate they were about providing great medical care to individuals with developmental disabilities, I jumped at the chance to become the county executive for Ohio. So I'm going to talk with you today about Station MD, how it works, the future, and just telehealth in general. So I hope today's presentation gives you information about what's going on now, but also what's available to you in the future. So Station MD is a specialized telehealth for people with intellectual and developmental disabilities. Our goal is to help people live and thrive in their community. So what is the service that we offer? Well, the service that we offer in Ohio is called healthcare assessment. We are working with the department, who has been awesome and super helpful to us, to make the healthcare assessment a new waiver service, potentially effective January 1st. Right now, it is on a pilot. I'm going to talk about that in a little bit. The new rule, the healthcare assessment rule, is on DOD's website. You can look it up. And we have a pilot with the department right now that they are funding the service for individuals across the state of Ohio. So some of you may have a loved one that you know, or maybe you're an SSA, you have someone on your caseload that is on the pilot receiving the service funded by the Ohio Department of Developmental Disabilities. And again, we're working for that healthcare assessment to become a service on the waiver. So Station MD is one of the providers of the healthcare assessment. I'm going to be honest, we're the only one right now. There is no other providers. However, we know that in the future, there will be other providers, and that's great, because our goal at Station MD is for people with developmental disabilities to get adequate access to great health care. So more providers, I'm sure, will come about as this service moves closer to being a waiver-funded service. So So a little bit about Station MD. We are telehealth specifically for people with intellectual and developmental disabilities. We were founded by emergency room doctors who saw people with developmental disabilities come into the ER unnecessarily on a regular basis. They saw folks coming into the ER that were misdiagnosed or coming in because they just had a common cold, the flu. They couldn't get in to see their regular doctor, or there were staffing issues like, hey, my staff accidentally gave me the wrong medication or I missed my medication, right? And they saw gaps in services medically for people with developmental disabilities because those folks were sitting for hours in the waiting room and then potentially getting misdiagnosed. They were around other people that were really sick, so they were picking up other medical issues while they were there. And then there were staffing issues, right? That staff had to sit with that individual to make sure that they were safe. And then there were other individuals that had to have another staff come in and provide the care for them. And they found that gap to just be unacceptable, right? And these doctors got together and developed Station MD. So they're super passionate, and I'm also very passionate, so it was a great match up there. So all of our clinicians are board certified, and they're specially trained in working with people with intellectual and developmental disabilities. And that's why I love this service, because I know for my son, when I take him to his regular doctor, it's great. But if I have to take him to the ER, they don't know him, they don't understand his medical diagnosis, and it is a major struggle. And that is one of the main reasons for this service. Currently, we serve in 22 states, and we've performed over 100,000 telemedicine visits with folks with developmental disabilities. We have lots of partners, and we appreciate all of the partners, of course, including the ARC. We are a first-line medical resource for provider agencies as well. I want to be clear, this is a service for the individual with a developmental disability, right? Folks are on the pilot right now. Eventually, it will become a waiver service. And so that service is for the person, right? It's not for convenience of a provider. It's for the individual to get telehealth services 24 hours a day, 7 days a week, 365 days a year. And it's for any medical concern, but it is primarily focused on the individual. So no one should be enrolling in the service for provider convenience or because of staffing issues. Although it's a bonus, right? That if someone enrolls in the service is for them, but it does also help their family, of course, and their provider staff. So Station MD clinicians have extensive training and experience in working with folks with developmental disabilities. That's why it is like a new frontier of telehealth, right? You can get telehealth through your current Medicaid if you have it, or through the insurance that you already may have. But this is telehealth specialized for your loved one that has an intellectual or developmental disability, because our clinicians are specifically trained. They know the system, right? They know what MUIs are, they know what incident reports are. They know everything about the system, and they will work with the individual, their family, their caregiver, their provider, and their SSA. And so it's a really specialized service that I think, just like Gary said, is going to revolutionize healthcare for the individuals that we love so much. So our clinicians understand the needs of people with high-risk medical needs and behavioral needs. They understand the challenges of folks living in a congregate setting, direct care staff, working with nurses, working with families and caregivers. They understand all of those things so that they can make sure your loved one is getting the absolute best care. This service, the healthcare assistant, does not replace someone's primary care physician, their psychiatrist, doesn't replace any of their doctors. This is an added bonus when your primary care physician is not available, or maybe you don't have one. So I want to talk a little bit about one of the main tenets of this service, and that is decreasing emergency room visits. How many of us, ourselves or a loved one, have gone to the ER, waited for hours and hours and hours, and still had to probably follow up with their primary care doctor the next day or the day after waiting for hours and hours, right? Sometimes we're misdiagnosed, sometimes we don't get a diagnosis, and it's very, very traumatic, especially for individuals with intellectual and developmental disabilities, right? So that is the number one purpose of this service, to reduce emergency room visits unnecessarily for folks with developmental disabilities. So top diagnoses from 2023 where we have diverted someone from going to the emergency room: rashes, seizures, cellulitis, an injury to the head or any other part of your body, behavioral issues, agitation, anxiety, depression. So in the very dark blue, those are all the times we treated someone in place, meaning they did not have to go to the ER. We diagnosed them, got them whatever service or medication that they needed. In the light blue, you can only see a very, very small amount up there. That is when we advise someone to actually go to the ER. Like, hey, you know what, Bob, your leg is broken. We're not gonna treat you on telehealth, right? We're gonna tell you to go to the emergency room. That's very, very little. We actually are able to serve 93% of people in place, meaning 93% of people that use our service do not have to go to the emergency room. They're treated at home with their loved ones or their staff, and they don't have to go to the ER. And they're being seen by a specially trained clinician trained in working with people with developmental disabilities. Tell me that's not revolutionary, right? So, also important to know that when we do see someone that needs to go to the emergency room, our clinician will say, hey mom, what emergency room are you taking Bob to? I'm gonna call them. You go ahead and get in the car and you take them. I'm gonna call that emergency room, I'm gonna talk to their doctor, and I'm gonna see if they can set up a room for Bob, have everything ready for you. I'm gonna give him all of the information before you get there, in hopes that when you get there, Bob doesn't have any behavioral issues. I know you're so nervous and worried. I know the last time he went to the ER, he broke a computer and was very upset because he waited too long, and they're gonna make that warm handoff. That is another part of this service that I think is monumental, right? Yes.
Yeah, way to go.
Yes. So, and these clinicians, I've met all of them, they're amazing. They deeply care, and their number one passion is access to medical care that's fantastic for people with intellectual and developmental disabilities. And I think for me, coming from a county board, all of my passion ranks in so many missions. I want to do this, and I want to do this, and this, and this, and this, right? Station MD has one goal, and that's their goal. And so all of their passion and commitment is going into that goal of great healthcare. And that's why I just love this service, because people are just really passionate about it. I've sat on some calls and just heard people just, okay, I'm good now. I'm gonna get my prescription refilled. I don't need to be stressed. I'm good. I want to talk a little bit about what we are often seeing people use Station MD for. And one of them is medication errors. I know from an SSA, when a staff person accidentally gives someone the wrong med or misses their med, it is like the end of the world, right? I mean, it's like, oh my gosh, there's going to be an MUI, they need to fill out an incident report, and I need to get a hold of the doctor. Is Bob going to be okay? It is such a stressful time, right? And then we're rushing to call the doctor, who we can't get a hold of, or says they're going to call back and I've waited 3 hours and I haven't heard from them. So Station MD is a telehealth service that when you're enrolled in that service, you have access to 24/7 telehealth care. So you can go ahead and call them, and just like you normally would for any other appointment, provide all of your information, wait in the virtual waiting room, and then when the clinician comes in, talk with them, and they will help you with that medication error. They will not only be able to tell you as mom or dad or grandma or grandpa or staff, this is what you need to do, or maybe they say, hey, everything's fine, maybe they want you to increase fluids, whatever it is. They're going to be able to tell you what you need to do, and they're basically going to be able to help you make sure, number one, the person is safe, okay, healthy, they're getting whatever medical care they need because of that error, but then also peace of mind for family, and then peace of mind for that staff, right? The staff that's working with Bob is really upset and worked up too. And then they're worried about getting in trouble, right? And then they're worried about what paperwork they need to do, right? We really just want you to focus on Bob and make sure he's okay, right? So this service will help with all of that. So it saves time, it saves the trauma of going to the ER. Lots of time when individuals go to the ER, they have behavioral issues. It could result in staff overtime if someone lives in a congregate setting, and one staff needs to take Bob to the hospital, and now we need to call in another staff to stay and help the other individuals because maybe they can't be home alone, or maybe it's bedtime and they need help getting ready for bed. And it helps with the need for additional staffing. We also get a lot of calls about medication refills. And right before I left Mahoning, we had this huge issue where we had a youth that came out of a residential facility. All of his meds were changed, right? And he was doing great because all of his meds were changed, right? We wanted to keep that. So he went on a waiver, he was going into a congregate setting, and the staff called and were like, you guys, they only gave us a script for 10 days, and we can't get into the doctor for 60. I don't even know what to do, right? So we kind of end up having to use the emergency room, right? Because this youth needs his medication. So if that youth was enrolled in Station MD, it said they could just have a virtual telehealth visit and get that medication refilled. That's another reason a lot of people call in, because it is an issue, right? And it's very stressful for families, for individuals, for staff, for people's caregivers, because you need that medication, right? Things are going well, and now all of a sudden I'm stressed out because maybe I can't get my medications, maybe I'm gonna run out. So what are some reasons that support staff or individuals or family members call into Station MD? Lots of everyday questions like medication errors, missed medication, I gave Bob the medicine at the wrong time, is that an issue, you know, that kind of thing. And then also potentially serious questions. You know, someone has hit their head, someone is vomiting and, you know, is not stopping vomiting. So our clinicians, you know, they are trained in working with staff, families, nurses, individuals with intellectual and developmental disabilities, and they're able to say, hey, okay, calm down, I'm gonna help you. Let's figure this out together, and then they have a regular medical appointment and handle the issue, right? And that's from the comfort of your own home. When people utilize this service, as I said, we see 93% of people not have to go to the emergency room, which is huge. So I'm going around, just like I am today, talking to all of you wonderful people about the service to tell them about it. And try to meet with county boards, meet with SSAs, meet with direct care staff and providers and the ARC and OPRA to make sure that everyone knows about the service. So as I said, right now we're on a pilot. So the Department of Developmental Disabilities is paying for about close to 1,300 individuals across the state of Ohio to use the service. And it's a monthly fee, that's like a subscription fee, okay? And that subscription fee pays for the actual assessment of your health. It pays for the 24/7 access to telehealth and those clinicians that are certified and trained in working specifically with people with intellectual and developmental disabilities. And then of course, when you have your visit, they're billing your insurance for that visit. So there's no cost to anyone that's on the pilot because the department is paying that fee. We are working with the department, who's been awesome, trying to make the healthcare assessment service a waiver-funded service. For many of you that have been involved or knew about the pilot, it was actually expected to go on to the waiver on July 1st, but CMS had some more questions about it, and so that waiver amendment got pulled, and now we are working to answer those questions and get it back onto the amendment cycle so that hopefully January 1st it is a waiver service, which is through all three waivers, IO, Level 1, and Self. We're really excited about that because that means then everybody on a waiver has access to the service. Also important to note that we totally understand that there's lots of people across Ohio that don't have a waiver. And so we are also working with county boards and providers. Any county board, any provider agency can enter into a contract with us and pay for the service. It's very inexpensive because you're just paying for that subscription fee, and then your insurance is actually covering the doctor visit. And so we have lots and lots of provider agencies and county boards reaching out about funding that service now until it goes on the waiver, and then also for folks that are not on the waiver. And in many other states, we do that. And we also have a lot of other states that their managed care organizations pay for the service, mainly because everyone knows managed care, you know, they want to prevent emergency room visits, right? It's traumatic for the person, it's also very costly. And so by paying for this service, it reduces their costs. So in lots of states, managed care organizations work with us and they pay for that subscription service as well. So I'm really excited about the service and excited about working with the department over the next several months on the pilot. If you're an SSA or an SSA director, I've been reaching out to all of you little by little and just following up to make sure you know who's on the pilot, you know how to use the service. My contact information will be at the end here. You can contact me anytime, and I can help you get an orientation so you know how to use the service, you know how to call in, and then we will keep working to have this service hopefully approved by Medicaid and go on the waiver on January 1st. Then really, everybody that's on a waiver, enroll in the service. We're really hoping for that because our mission really is to help everyone get access to great quality care. And we're seeing it now with the people that are calling in literally every single day. We're preventing those individuals on the pilot from having to go to the ER unnecessarily. Everyone knows, whether you have a disability or not, that ER, it is upsetting. I mean, those doctors, those nurses, those clinicians, everyone working in that ER, they're amazing, right? They are working really, really hard, but they're full. You know, the waiting room is not ready. There's not enough room. There's not enough chairs. We're waiting hours. We're getting exposed to people with other kinds of injuries, other people that are very upset, other people with medical issues that are contagious. And then we're also meeting with doctors and nurses that aren't specially trained in working with folks with intellectual and developmental disabilities. I can remember when my son was very young and I took him to the emergency room because I had to. And he has a very rare medical diagnosis. And when we first went in, I still remember, as probably many of you moms, dads, grandmas, and grandpas remember, when you've had a traumatic experience at the ER, right? Yeah, head nods, right? We've all had it. Even when your child doesn't have a developmental disability, taking them to the ER can be really traumatic. I still remember the face of the person that talked to me and every single word she said. And I still, when I think about it, my blood starts to boil, right? I mean, it just, you know, I think about it and I'm still mad. I'm like, oh, this is like 10 years ago and I still am upset about this. Because he was treated differently because he had a medical diagnosis and there was a preconceived notion about what was wrong with him and it wasn't correct, right? So the mama bear in me came out, right? We've all been there, right? I wish we had this service then because he could have been treated from home using a telehealth service, right? And to have specialized clinicians, that's the ticket for me. They're specialized. That's not available on just regular telehealth. These are clinicians that are trained, that meet regularly, that go over different diagnoses that are coming in so that they can provide your loved ones the best care possible. So when using the service, whether you're on the pilot or hopefully January 1st when people enroll on the service when it's on the waiver, it's just like any other doctor appointment. You need to have their insurance information, their date of birth, their symptoms, and then you need to have a smartphone or a tablet, right? So you can utilize the service. We do always ask people to take blood pressure, temperature, and use your pulse oximetry meter. It is not the end of the world if you don't have those items. Most people do. They're very inexpensive. You can get them at your regular local drugstore. And if you're a provider staff, you probably should have that in the home anyway, because those are very telling of someone's health, right? Those are the first things that a clinician looks at. No device. For me, I always try to tell everybody, okay, if there's any barriers, I want to tell you how to overcome those barriers to get this service. You can use their waiver to pay for a communication device. If they have that assessed need, someone can purchase it independently. There's lots of community programs available for these kinds of smart devices. Also, some people bring up no internet. Just remember, the department does have the Internet Assistance Program, and using telehealth is one of the reasons you could utilize that, where they assist in the funding of the internet. You could private pay. There's also so many community programs out there to help people get free or very low cost internet. Station MD prevents the fatal 5, meaning we are able to provide peace of mind to staff, to families, to individuals, helping them know when to act and what to do next. That's the point of the healthcare assessment. They're assessing your loved one's health. What do you do next to keep them safe, to keep them healthy? It's assessing the person and intervening before that condition becomes life-threatening, right? They're able to tell you, hey, I can treat this right here, right now, this is what we need to do. Or, hey, this is beyond a telehealth visit, you do need to go to the emergency room, let me help you coordinate that. Our clinicians are able to guide, support staff and families on how to monitor the person for symptoms of a worsening condition or a medical emergency. Our clinicians also follow up, and this is another biggie for me. They follow up with the individual to make sure they're getting the appropriate aftercare. That is super important, because after an appointment, when you're told to get a medication or do these certain items, follow-up needs to happen, right? We need to make sure that the individual is following those guidelines. You know, their staff, their family has got their meds. If there's some kind of a barrier, we can help with that. So who benefits from Station MD? I mean, everyone, right? People with intellectual and developmental disabilities obviously benefit because they receive immediate access to clinicians that understand intellectual and developmental disabilities. It reduces their time and energy spent accessing their health needs, right? It improves their quality of life. It gives them time to do the things they want to do, right? Bob doesn't want to miss the art dance tonight because he's in the ER because he had a missed med, right? I don't either, right? And that is going to be helpful if he's enrolled in Station MD. He can make that call, get the service, handle what's going on medically for him, and still go to that art dance. It's helpful to caregivers and support providers because, again, it's immediate access to health care. It reduces those ER trips, which is essential. It offers a peace of mind for the family members trying to help their loved one as well as staff. It also prevents caregiver burnout that could lead to staff turnover, abuse, and neglect. These are all tenets of the service that are extremely important to all of the clinicians at Station MD. For provider agency administration, it's obviously helpful to them because it gives them to give an individual another option for healthcare, right? We all deserve the best options for our healthcare, whether we have a disability or not, right? Equal access is extremely important, but in addition to equal access, people with intellectual and developmental disabilities deserve access to healthcare with clinicians that can know and understand them and treat them so that they are healthy and live their best life. They deserve that, right? And that's really what Station MD is all about. It obviously reduces for agency administrators all the extra paperwork that comes with an ER visit and a potential hospital hospital admission, especially if unnecessary. So it's for the person, it's not, for staff convenience. However, there are added benefits for families, for our direct care staff that are really instrumental in helping those staff focus on the individuals. Do we want our loved ones living in a congregate setting, hanging out, playing Monopoly, eating snacks, or do we want them to be in the ER because they missed a med? And that's really what this service is about. Just want to talk about trauma. It's so traumatic going to the ER. I saw so many head nods when I told my story about my son because we all have those stories. We all have them. We all can remember them. We probably all have more than one. And our loved ones have them too. I read a book recently about how someone with communication issues walking into a place where they were traumatized, even if they can't hear, even if they can't see, even the smell of a place they were traumatized in before can harken them back to something bad that happened to them or a traumatic experience. It was mind-blowing for me because it was like, yeah, that is 100% true. It's true for all of us, whether we have a disability or not, right? And I'm very, very focused on trauma because I feel that so many times people with developmental disabilities are told, oh, they're having a behavioral issue. You know what I mean? No, they're not having a behavioral issue. Okay, they punched the wall because they've been in the ER for a UTI for 5 hours. I kind of want to punch the wall too, right? but I'm able to communicate with you. I'm irritated, I've been here too long. But the individual with a developmental disability, they may not be able to communicate that. Their communication is punching the wall. That is communication. That's not a behavior. That's communication. And I think that's so important, because when people are at home, that's our calm space, right? That's a place where our mom is. That's the place where our staff who love us is. That's my calm zen place. And if I'm having an issue and can't see my primary doctor, who I love, then I can use Station MD, and I'm gonna get my needs met, but I'm gonna remain calm, because I'm in my happy place, right? I'm in my pajamas, right? And that's okay, because I didn't have to go to the ER. Our clinicians are also trained in de-escalation, so if someone's having a behavioral health concern, you can call in for that as well, and they will help de-escalate the situation. And a lot of times people will call in and they're very amped up. We had a call the other day about someone that they ran out of their pain medication. Oh, it just broke my heart, because the guy was just like, I'm insane. Yeah. Like, I need help right now. Yeah. And our clinician actually knew them, had all their information, and was like, do you want to get on virtually? You would just give you a call and refill your script. And they were like, call me. And so that clinician was able to call them, get their script refilled, and there wasn't any stress or drama, because it got taken care of and it was done via telehealth. So just want to quickly talk with you about future state. So right now we're in the pilot. They're not adding anyone new to the pilot. So we've only got a couple months here till January, and again, we're hoping that the service goes on the waiver in January. I'm sure we'll keep in touch with Barry and Dave, so they'll let everyone know when it does go on the waiver. And then when it does, the way to get that service is like any other waiver service. You gotta go to your SSA, right? And then your SSA will make sure your loved one has an assessment for the service, put the service on their Ohio individual service plan, add a service and support for it, and then they will put it in to be funded. And the services will be on all 3 waivers, and for cost, it is 1 unit per month. So you're paying a subscription fee, 1 unit per month, and that gives you access to 24/7, 7 days a week, 365 days a year, telehealth services. And again, when you see that clinician, they're just gonna bill your insurance like any other doctor visit. I'm gonna keep going around and talking with SSAs, because I think SSAs are the ticket, right? And I know some SSAs I've seen in here, and those SSAs are awesome, and they're so busy, but I'm gonna keep talking with them so they know how to enroll people in the service. And basically, when it does go on the waiver, they would just put that in the plan, 1 unit per month. I do have the codes up there, so that folks know how to enter them into the system. And basically, I'm kind of flipping around too much here. I'm getting excited, I think. So I just kind of in closing here, to start your telemedicine visit. Again, if you're on the pilot and you have questions, my information is at the end here. You can contact me. As we move closer to January 1st, hopefully when it does go on the waiver, everyone's notified. And then if folks want the service, they put it on the individual service plan. As soon as it's on and authorized, they can go ahead and start using it. Just again, make sure, have all their medical information, have a tablet or a phone, and if possible, have that pulse oximetry meter, blood pressure cuff, thermometer. And then basically, you're gonna call in 187-STAT-MDS, Station MDS. And it's gonna be like a regular doctor visit. You're gonna talk with a telehealth specialist that's gonna get all your information, and then have you in a waiting room, and then the clinician will join you momentarily, and they will hop on and they will assist you with whatever you need. They'll be able to help your family if they have questions. Anyone can be on the visit, which I know is an issue, because sometimes they're like, only one person can come back with them, right? Station MD is not that way. Your whole family and your neighbor can be there if you'd like. Whoever the person wants to be there, right? And then of course, if someone lives in a congregate setting or maybe an intermediate care facility, their staff would be there too. And our clinicians know and understand those relationships and can talk with them as well to make sure the individual gets the care that they need. And then just some patient information. 96% of people were happy with our service, 94% would recommend us, 84% prefer to use that service over going in person to urgent care or the ER. And in the end here is just our goal of providing the highest quality of medical care for individuals with intellectual and developmental disabilities, fostering independence, and improving quality of life. That's the point, right? Less ER visits, more time at our dances, or hanging out at home in your PJs with your mom and your dad watching a movie, right? And so, again, if you have questions about the pilot, please let me know. As we move closer to the waiver, we really hope people take advantage of this service. And certainly, if your county board or your provider agency is interested in working with us for folks not on a waiver, let me know. Now that I work for this company, I'm really high tech. So if you scan that barcode, it will make me one of your contacts. I thought that was really cool. But if you don't have that, my name and my phone number up here, and I think Gary and Dave have my contact information as well. On the left-hand side, there's also a link, and there's some videos about the service that you could watch and kind of guide you through how to use the service. Any more questions?
Well, I got a couple while I was sitting there.
Okay.
Can you hear me?
I should
Not that one.
Oh, the other one. Okay.
Thank you. So I.
Sorry, I didn't turn it on.
So I already had a couple questions as
Okay.
I'm warming around.
Perfect.
We have some parents in the room who would like to private pay a subscription.
Okay, so that is something that you could contact me about. We don't quite do that yet, but that's something we could discuss and talk with my administration about. So call me, email me. I'm happy to discuss that and excited that people are excited about the service. Yes.
You just keep saying that the doctors is going to be paid by your insurance, but we all
Can't hear.
know that there's also contract providers and that
Oh, I'm so sorry, I cannot hear you.
I said you just keep saying that the doctor risk portion will be paid by your insurance, but we all know that insurances have certain providers that they're contracted with, et cetera, so that seems like an interesting blanket statement, I guess. Because everybody in the room has different private insurance and Medicaid and whatever. So.
Yes, yeah, we do take Medicaid and we do work with managed care organizations. If you had an insurance you were not sure about, please contact me and I will follow up and find out. Good question, thank you.
Anything else?
Oh, wait over here.
I'm gonna smoke this thing. I love this.
Like your pharmacist?
No, that's Gary.
That's Gary.
It's Gary. That's there.
Based on the pilot, how
She's got
long
it.
is the typical wait time for the provider to come on to the hill?
You need to come on to the doctor's appointment?
From like the wait.
Oh, I got you, okay, yeah. You know what, it varies, because it just depends on how many calls have come in. You know, sometimes we'll have a call come in and it's really quick, and other times we'll have a call come in and it's very long. But I can tell you from my personal experience, I've sat in multiple times and I've seen people wait like 10, 15 minutes at the most. Sometimes it's quicker than that. So it really just depends. It's the same as like going to your doctor. Sometimes you go, you get right in, and other times it's a lot longer. It's hard to determine like the actual time because it varies on so many factors. But I've not seen it take a huge amount of time because it is all virtual and you're from home. You know, you're just kind of waiting there virtually for the clinician to pop in. So good question though, thank you.
Hi, I'm very excited about this. It sounds great.
Good.
I guess one thing that I think would be great in your pilot program, if you could tell us more about it, and if you dealt with, I think it's great for especially the aging population too. Because, you know, as we age, we go to the doctors more, especially with our, you know,
Yeah,
our population. And parents aren't going to be around as much too, so that makes me feel good that you guys know about disabilities and how to deal more with the aging too. Thank you.
Yeah, absolutely. So the pilot is funded through the Ohio Department of Developmental Disabilities. Right now, there's about 1,288 people on the pilot, and they've been using the service for quite some time now. So the department is paying that monthly subscription fee. And then they're utilizing the service. We're billing their Medicaid for their doctor's visits. And then basically we're sending monthly data to the department to say how many people have utilized the service. And then of course they want to see how many ER visits we have diverted. Basically, that's where we get the 93% from. And that is really the basic gist of the pilot program.
Do you deal more with like the elderly, like the part that got me going to the doctors and stuff? Like, do you help that when you get more sick, when you get older and stuff? Have you gotten into the older population?
We have not gotten into the older population yet, but that doesn't mean we won't. Right now, we're specifically for people with intellectual and developmental disabilities. However, since I came there, we have been talking a lot about serving
Well, I guess I'm
youth.
talking about the DD population that's
Yes.
older.
Yeah, good question. So she's asking about elderly people that have a developmental disability. Yes, we see a lot of people that are elderly all the time, daily, that also have a developmental disability. They fully understand that and can help with any of those issues as our folks age.
Good,
Yeah,
thank you.
so, yeah. Good question.
I know we've got people from a few other states here. Is this available in other states?
It is. It's available in lots of other states. We are in Missouri, Pennsylvania, New York, New Jersey. We are working on Oklahoma, New Mexico, Illinois, and Indiana.
Okay.
So, yes.
Is this in all the counties in Ohio and are all the SSAs in other states?
We are in all the counties, and I would say no, I don't know that all the SSAs are aware of it, and that's my job, and I just came here, so that is a great question. I am going around doing presentations. I'm hearing from so many SSA directors that their SSAs want to know about the service. I saw some SSAs from Portage back here. Yeah, Portage County. I was just there talking to them about it. So they have some people on the pilot, and I just presented to them virtually, and I presented a couple days ago in Lake County. So SSA directors are reaching out to me, and I am doing presentations, letting them know about it. And you are correct, when it is on the waiver, it's available to everyone in every county in Ohio for individuals that are on waivers. And if folks are not on the waiver and they want the service, let me know so we can kind of figure out how to do that. Great question, thank you so much.
I have a quick question. So during the pilot, did anybody ever call in with like suicidal ideations? Like, is this recommended for behavioral health on that level?
That is a very good question. I'm not aware that anyone called in with suicidal ideation. However, our clinicians are trained in behavioral health, and if someone was suicidal, they would immediately take action to make sure that they were safe. They're all trained in that, and they know and understand how to follow up to make sure with their staff, with their family, that even after the call has ended, that they're taking steps to make sure that person is safe. I will also mention that today my focus was on what we call like our urgent care line. We do have a whole behavioral health side where we have psychiatrists that county boards and providers can fund for someone to see a psychiatrist, and that is a per member per month fee that they pay for, and that is like a separate side of our agency. So we do see a lot of people for behavioral health issues on that side of our business. That is not going on the waiver and it's not on the pilot. That's why I didn't bring it up today, but I'm so glad you mentioned it because we do have that. And we're starting to hear from a lot of county boards and provider agencies in areas where people are having behavioral and psychiatric issues and they don't have psychiatrists there. And we've been able to set up contracts to help them with that, to fund that service in their county or for that provider agency for those individuals to see a psychiatrist. They are also specially trained in working with folks with intellectual and developmental disabilities. Thank you. Thank you so much. Have a wonderful day. Thank you, Gary, for having us.
I'm here to grab my computer.
So David and I presented to a foundation that's very helpful to us last week. They refer to us as the odd.
Oh, no.
I'm not sure who's odder. Probably me.
I would agree with that.
So what we'd like to do with you right now is kind of summarize the day. Before I begin that though, any of you that need continuing education units, They are out on the table, so don't forget to pick them up. You get 3. They're available for any independent providers, any agency staff that need them, SSAs, superintendents, you'll still the list. If you're an independent provider, don't worry about checking the boxes. This is just that you were actually here and you got 3 hours of continuing ed. You're not counting David and I's bill today.
So we only have 3 hours?
So at 2:30,
So
we've got 3
3 hours?
members of the governor's cabinet
Where does this
and their
say 3?
staff, and the director of the Office of Exceptional
Oh, right
Children
here.
come. Those of you who know us well, every other year we do a legislative reception with a cocktail.
Mm-hmm.
We're serving lemonade and iced tea and cookies. The fact that we're coupling it with a casino, we had some people say, I don't think you want to serve alcohol. So if you need alcohol, they're at the bar. But just a reminder, 3 of these are members of the governor's cabinet: the director of the Department of Medicaid, the director of the Department of Developmental Disabilities, and the director of the Office of the Ohio Opportunities for Ohioans with Disabilities, which is our vocational rehab department, and the director of the Office of Exceptional Children within the Department of Ed. Johanna is essentially the director of special ed for the state of Ohio. So they asked me, well, thank you for the invitation. What do you want us to do? And I said, I want you to be available for family members, people with disabilities, and the grassroots system to just mingle and talk. When I did my budget testimony this last year, I actually said in testimony that I believe that Ohio really is blessed to have these people. I know each one of them, they are each in their position because of how much they care. I've known Maureen Corcoran for over 25 years, who is the current director of the Department of Medicaid. It is the largest department in state government, and they are responsible for all funds that flow through for not only our waivers, but the home care waiver, the passport with aging. It's a very powerful, very influential position. Maureen is the only Democrat in the governor's cabinet. She is there because she is brilliant, but she also has a nursing background and a compassionate heart. So my advice is not to jump on her, but she will be available. She told me if she's late, it's because the governor had wanted her to meet with him too.
She's also a parent, right? Family member?
Yeah, she's adopted 2 children, one of whom has some challenges. But, Mike has precedence over us, so. Kim Hauk, who you've all met, is the director of the Department of Developmental Disabilities. Kim has a special ed background. She was a special ed teacher, so she knows she comes to this for other reasons. She will be bringing her deputy directors. I should mention Jesse Wyatt is coming with Maureen. Jesse's in charge of long-term care, as I mentioned this morning. But Kim from the Department of DD will be bringing her staff along, who will also be available just to talk. Kevin Miller, who's the Director of Opportunities for Ohioans with Disabilities, oversees all of our vocational rehabilitation programs. But what I keep reminding Kevin, not that he needs reminding, is that Kevin is the parent, the dad of a young man with autism. And when he comes to these meetings, he's coming as Kevin dad, as much as he is the director. So if you've got challenges with him, feel free to discuss it with him, but he comes here as a parent. Johanna Ward is the director of the Office of Exceptional Children. She's coming alone, but she's been extremely helpful. I can tell you that if we have a problem with the school district, we do our advocacy issues on a local level, but we email or we call Johanna. And if you're getting a call from the Ohio Department of Education about why did you do this, or didn't you quite understand what's going on, people, their ears perk up and they listen. Emily was so nice to talk about me. Cry.
Don't cry today.
No.
It's all right.
We used to have a
Where are you going? I want you to pick up on.
We used to have a saying in the ark is always there.
It is. I think, and again, I think we have to remember we're standing on the shoulders of all those parents and people with disabilities and families that came before us, right? So ARC's been around since 1950, started by moms, to be quite blunt, who fought for services for their loved ones when there were no services, right? You had a child with a disability, the school system basically said, take your kid home, we don't have anything here for them, so they fought for what exists now, and obviously there's been updates and changes, but we still have a ways to go, and we're our support of people with disabilities and the families.
So those of you who know me from Facebook, like Becky's Facebook, Candace's Facebook, those of you who know me from Facebook, those of you who call, if there's a challenge, I've got every one of these directors' personal cell phone in my cell phone. And
that's why we love you, Gary.
well, it's not because of me, we've been around a long time. 1950, we know that we still have parents in this room, we have founders that would lie down on I-71 for their kid, their sister, their loved one. That is our clout, that is our power. We know that each of these directors pick staff that also want to do the right thing. They are bound by a lot of, bullshit, and I can do bullshitty bureaucracy sometimes. I'm live on Facebook when I'm and they have to deal with stuff they don't want to deal with, but they have to deal with it. And what I'm promising you today is that we try to cut through the crap and just get to the heart of the situation, because each of these directors, each of their staff do care. So we're going to summarize. So
Is that what we're doing?
I guess so. So one of the things we heard loud and clear is we want to go to the Department of Medicaid and talk about electronic visit verification. We understand that our waivers are not included in the billing versus the EBV at this time, but we've got problems with Sandata, that it just doesn't work. What I heard this morning is we want independent providers exempted from the mandate of having to use Sandata, that there might be an option for us to use.
So on that note, I want you guys to know that there is some discussion that we've had with a group of people who are hiring a lobbyist to actually try to tackle that issue, because we do not feel it's a fair thing that they're mandated to have to use one system versus an agency can pick who they use, like an alternate EBV. So there is some discussion happening around that.
And it's legislative.
Yeah.
The mandate to use Sandata is in state law versus what's called administrative rule. Okay? We talked about the rate increases. David and I are part of a budget coalition with the county boards, with the provider trade associations, and we're going to be including a broader spectrum of advocates on the table. And we've done some preliminary surveys. We think for the most part, and you need to let us know, we know we're situated. Independents got the grades automatically. Most agencies from the surveys we're getting are telling us that they did give increases or more benefits. But we're going to need your help in gathering that information. The current survey that we did was kind of voluntary. The survey that the state will be doing next, when this year is up, is not going to be voluntary. We're going to know who gave increases and who didn't. But you need to know we're already working on the next budget cycle. So we had hoped before to get an average of $20 an hour for agency staff. That is still our goal. So we're going to be going back to the legislature. Our role is to get your input and your stories about how going to about $30 an hour for an independent provider has helped. Alan told you we're getting more and more independents. We need your help in explaining to the legislature, while we might be getting close to an average of $17 or $18 an hour for agency staff, it's still not enough, because the state will employ those same kinds of individuals in developmental centers in excess of $20 an hour plus state benefits. Most of our agency direct support staff have no benefits. So we were able to get the rate up to pay more, but they still don't have benefits. We still have independent providers who can't access health insurance. They can't access retirement. Even though it looks like they've got a lot coming in at $30 an hour, they're having to pay the taxes often, and they don't have benefits. And if we want to make this a sustainable career, we need to get that up. Remember, the budget process has already sort of started. Each department will be submitting their budget recommendations by this fall to the governor's office. He will not announce his projected budget, his proposed budget, until next year, usually around early February. That's where we're going to need your help in, like you did the last time, talking to the General Assembly, coming to Columbus and testifying, or writing a lot of letters, because we still need to get those wages up, not only for independent, but agency staff.
I think we also need to get wages up, if we can, consistently across all services in Ohio too, right? So there's a spectrum of services that need to be available for people with disabilities and their families. It's our job to educate, inform, advocate from an individual and a legislative position, but at the same time, we don't make decisions for families, for individuals. We want to educate, inform them of the systems, of the rules, of the process, so we can make it better.
So you heard Janet explain this morning that the DDP, the Ohio Developmental Disabilities Profile, is going to go away. We don't have a firm date when that happens. And as a reminder that if you have an IO waiver, there is an assessment tool called the ODDP that determines your funding range. And there are 9 funding ranges. And sadly, if you live at home with your family, you're typically in the bottom funding range. When the SIS is being used, we're going to get you copies of that. We'll put it on our website so you can actually see what the instrument is. The counties will be trained in how to implement it. And as she said, this is going to take a couple years. We'll have to take the ODDP out of administrative rule, put the SIS in as our new assessment tool, and go through a training process. I would like some of us to be trained as well on how to implement it. Many of us went through the ODDP training just to know what's happening. We then have to make sure that there is no continued bias against family members in the funding. If my son has a complex care need, just because he lives with me and I don't happen to have a son with a disability, my neighbor shouldn't be paying more to support my son who has exactly the same needs. So that will be one of our missions. This didn't come up a lot this morning, but another one of our missions, and we want to talk to the director of Medicaid about this, is ever trying to find a dentist. Even with this new program, the rates are so deplorable for dentists, physicians, and others that you can't find them because as a business, they can't accept that rate. We will be working in a coalition with other advocacy organizations to not only raise the rate of waiver providers, but raise the rate of Medicaid state plan service providers. That's going to take some effort because, it is what it is. With Medicaid, remember, it's about 60% federally funded, 40% state. We get an increase in the rate. The state's going to have to get that same, they'll have to increase the rates. Yeah, Janet.
Can you tell me who or how do these pay rates get determined?
It's all part of the administrative rules. So we've been historically really good at following developmental disability rules. But these are the Department of Medicaid rules, and they determine So the federal government puts in the 60%, and then they allow the states to determine how much they're gonna pay the providers of the service. So it's even on pharmacy. So every once in a while, that pill I've taken forever and they don't cover it anymore. Well, that's determined in administrative rule. So we've got to get the rates up for physicians, dentists, durable medical equipment providers, and some kind of medications. And it's on the
And nurses.
And nurses as well, yeah. Even though nurses got an increase, I can work for a hospital and get triple what I could get.
I have a real issue with the, and if somebody don't like this, I'm sorry, but I have a real issue with the pay rate for residential respite.
Okay.
Yeah.
Because, I don't know if I should even say this, but.
That's okay. I said bullshit, you can say that.
Residential respite, I don't know if anybody realizes this, but if you take in 4 clients in one day and work 5 hours, you're making $450 in those 5 hours. You can make probably over $2,000 a month working 5 hours a day.
Right.
That's $80 an hour. That's crazy.
Right.
I would give up my independent provider for my sister and do just residential respite.
Right. So those of you who don't know, residential respite is a new service, and so often with the new service, David and I worked really hard to get it in. We worked with the administration, and then we have to.
I mean, residential respite is a great thing, but as far as the monies go, you know, if I'm a provider and I'm providing those services, it's great. But that's a lot of money. That's a lot of money.
Because correct me, there's no group rate.
That is the group rate.
There is the group
That
rate?
is the group rate.
Group rate
So-
of 4 people
Yeah.
comes down to $20 an hour per person. That's $80 an hour.
$80
That's the
an hour.
group rate.
Ooh, okay.
Yeah.
We got a question.
Yeah, that, I've got to look into that. That seems kind of really strange.
Yeah, we've got one back here, then we'll get to,
Okay.
It's on the chart.
When
All
we
right.
were talking about the independent providers who are doing like HGC needing, you know, they have to pay their taxes, they gotta do all those things and they don't have insurance. What about shared living? We are tax exempt and we can't get in. I have to pay for insurance when I'm a single parent to a special needs child doing shared living. And along the same lines, my daughter's a provider and she can work 5 hours when I make it 24 hours.
Right.
So, you know, and I'm trying to pay for my own insurance and co-pays and deductibles and, you know, somebody had mentioned somewhere along the line about a magi, but they said, you know, don't do that because then they take from you later. Or, I don't know how that works, but I'm a single parent to a special needs child on a fixed income basically because my hours are limited.
Yeah.
And I can't get insurance, I have to pay for it. And it's
Right.
you know, it's taking a lot out of my income.
And the ARC straddles both. You know, we do not technically represent independent providers, but most of our independent providers are family members who we represent. So, and getting rates up and getting benefits and all. So that's,
Right.
you
So
have to know we're the ones at the table yelling about independent providers, yeah.
Sure, but what is this
Better
laptop?
people.
Can we get it because we're technically zero income? But then what happens, somebody keeps saying, don't do it, and I don't know why.
I'm an expert on
I
those.
don't think we could make, again, like a blanket statement if it would be good for every person. I think it's individualized, so we could sit down with you and try to look at what that would be.
Is there a penalty somewhere down the right road to get older if you?
Well, I think there's Medicaid payback, there's other things that get involved in some of this stuff, so it's not something I would feel comfortable answering on stage for an individual case.
So how about I make contact with Medicaid?
Yeah.
Get a Zoom meeting together
Okay.
so we can
Okay,
ask
because
those
if I have
specific.
zero income, how can I pay you back later?
Right,
Right.
yes.
Right.
And I know we had a couple others. Oh, Becky, go ahead.
Yeah, regarding, I'm gonna piggyback on what Janet wrote, I'm kind of pull back. Janet called me with this rate increase, and it's like, really, we're looking at this $80 for 4 clients. And I said, let me email Naoka and see if this was an error. And she sent this email, and it says, basically that they wanted to make it enticing for providers to do this job. That's why they made it such an astronomical amount. So that's
Well,
basically.
and it's new. We get something in, we get our foot in the door, and then we
Yeah, from January till July, there was no group rate.
Yes.
And then in July, and so you got the basic rate for everybody. And July, the group rate started, but it's only like 50 cents, maybe less an hour for 2.
Right.
And then for 3, by the time you get down to 4, Janet's right, it's $20-some an hour, and it comes up to about $80 if you have 4 clients.
I keep getting texts. I donate to both
Yes.
parties because then
I
they'll talk
have,
to
I
me.
have everything here.
So I get a text from the Democrats and then 10 minutes later I get a text from the Republicans. And they all want money.
Excuse me, residential respite, what you ladies are talking about.
Oh, where we at?
Okay, so residential
I
respite.
thought that was for the shared living.
Yes.
It's relief for the primary caregiver, yes.
So are the units that they're able to have for the month, is it an individualized case?
Yes.
Okay, because
Yeah.
have limits though.
Red is at 52 hours.
Has only been able to get like 12 hours a week.
It's 12 hours a week.
Yeah.
So how are they talking about 20 hours a week?
No, they're talking about if one provider provided
Four.
residential respite to 4 people at the same time.
Now, how do you do it with 4 people at the same time and you've got 4 different houses?
I can
No,
tell
they're
you.
not in houses. They're,
Okay.
the residential respite can be in the house or out of the house. So let's say I'm gonna take 4 people to the Columbus Zoo for respite.
So wouldn't that be a 4-to-1 though?
It
Yeah.
would be.
It is,
Right.
it
And
is.
it's $80 an hour.
But wouldn't each person pay, if it's a 4-to-1, each person will pay a portion of that? So
Yeah.
we're paying for one, we really should be billing for one person,
Per individual.
per unit,
Per individual.
Per
per
person.
person. But if it's a 4-to-1, each individual
It's
pays
per
for that one hour.
Right, it comes out of their budget in a 4-to-1 ratio, but still, if the ratio is not calculated correctly, which I'm surprised that it would be $80 an hour, but
It is.
So Kim, our visitors have arrived. So can you talk to David and I individually? Is that all right with you that we begin the reception early?
I just wanted to say something.
Sure.
For the providers to get the rate increase, it's gonna be us, people with TV, who's gonna fight for you. Because we all agree that you guys need a rate
Yeah.
increase, again. Second is, I'm hearing things from my county and from another county, that some of the agencies aren't giving the providers a rate increase. We need somebody to be in control of that, regulate that, and make sure that they get it.
So we're gonna be making sure that they have to do what's called a survey. They're gonna have to tell us what they did with the money, and you're gonna have to help us for those who weren't honest and let us know.
yeah, so every provider in our system, independent agency or certified, are required to fill out that survey, that data report. So then eventually the thinking was that data becomes public information on the DODD website. So yes, but it doesn't always mean they have to pass that money on in a direct hourly wage increase. There's other benefits.
Okay.
I
Okay,
just
so-
have one
okay.
statement, you know me.
Yeah.
I think that the most important thing that we can talk, that we need to resolve immediately is the provider certification issue, because it's taking too long. If an agency can onboard a person in under 30 days, there's absolutely no reason that we cannot onboard an IP in under 30 days. And we have to do that because those of us with complex care, medically fragile kids are drowning.
Exactly.
Yeah,
Did you
yeah.
come here on the committee with David and I? Okay. So,
We're already forming a plan to meet out before the first meeting, so.
yeah, you can be assured your voice will be heard. So,
Yeah.
this next part is very open, but I wanted, Maureen will be arriving later. As I said, Mike wanted to see her. So, but I wanted to introduce our visitors. Kim Hauk is, if you could raise your hand, Kim. Kevin Miller, Johanna Ward, and Maureen Corcoran will be coming sooner. So we've got cookies and lemonade. Where are they going to put them in the hallway?
I don't know, man.
I don't know. I'll find the cookies. Open the door.
I will definitely find it.
Thank you all for being here.
Yes, thank you.
We really appreciate it.
That's cute. Really cool.
I know you're gonna step on me. What are you gonna do? I said,
Like, I wanna get on that commission, because they have to hear the behavioral side. People forget about us.
I'm gonna go zip by. Yeah, I'm gonna zip by them real quick. Yeah, it's been fun, but it's time to head out.
Oh, no, they asked me to take a picture with me.